So today I'm going to talk about my nerve block injections that I get. They are for headaches and migraines and some of the shoulder pain, neck pain that I experienced from an injury. So today is the day after and I'm actually, not doing too bad. Would love to sleep the day away. I'm tired. I am sore. I doubt you can tell, but with the glasses there you can kind of see there's some swelling. My left side is the side that has more issues, so I get more injections here than I do. I get some here, but I get more quantity here. So you can see how I don't know, you probably can't tell I'm swollen, but here you can tell I am because that's where the glasses cut in. And in here it's all puffy. And I have that, some of that, but not usually that much. And if I look a little red, that would be because I was in the sunshine yesterday and I sunburn easy. So I also get the nerve block in here, and then all in my neck on this side because this is the side that, again, that is the problem. But other than the puffiness, you're not really going to be able to tell the next day. That's one less thing you have to worry about. If you think about when you go to the dentist and you get needles, and you get your teeth worked on, part of it's the teeth being worked on, but part of it's the needle. And it's very similar. Needle inserted at the base of your skull, or maybe, and that is where I have most of my pain, is the base of the skull on this side, always. So it feels absolutely wonderful to have that diminish. It doesn't go away. I wish, it feels like I want them to go in further and deeper. So we haven't cut to where it says the neuralgia and headache pain up top here. It does help freeze a lot of that up, and it does swell, and the swelling's gone down mostly today. It is sensitive today, but it's not, I could lay on it if I was to want to sleep on it. As time has gone on, I have less sensitivity in my scalp, so it doesn't feel like every time I brush my hair, it doesn't feel like I'm ripping my hair out and, scraping and cutting the skull, which is where I was at the point of before. So it has helped immediately, and then it does help as time goes on. It's teaching my nerves how to turn off, because I've been in pain for over 10 years, all day, every day, all day, all night, with the headache pain and just the pain pressure, and then the migraines on top of that, and the headaches ramp up worse. So this has provided some relief. The temporary relief is 4 to 6 hours, and sometimes even a little bit longer as it wears off. Like I'm sensitive in here now today because of this needle in here. It does freeze my sinus sometimes because I do have sinus headaches. And so this in here, I get the headache in here, in the eye and in the temple. And I've had some in here that they do. The sinuses are a headache issue, so that's why the sinus is swollen, because he does some extra in here. It's a bit sore, and it's not actually any more sore in here than it normally is, even though he injected that muscle. In the neck here it is sore. Those are smaller muscles, so they'll feel it more. When they inject, you feel it. And then the freezing kicks in, and it's pressure, but it's not usually a painful pressure. So it has its stages, and it's not always exactly the same each time. So I would say try it a few times first before you actually decide. The first time I did it, it was like, oh, night and day. And the next few times it was awesome. And then one time where I wasn't as happy with it, and the next time it was better. So if you talk to your neurologist, or sometimes you can do pain clinics if it's this. And if you talk to them and you describe them what works and what doesn't, which they want to know, then they will sometimes tailor it more to your needs. I don't get them in the chin or in the cheekbone. I don't have the pain problems there. This is the one that they do, this side they do like more than the original amount. And they can do it, they do 2 of them up higher, where the greater occipital nerve points. They do that a lot for me. And then I get the lesser occipital nerve as well. And my left hand side is added a whole bunch more to that, both of those. And then they'll go down along the neck muscles as well. And then they do the face. 2 times ago when I got these needles was the first time I ever have had a 2 out of 5 for pain scale during this, an hour of having this. A 2 out of 5 compared to my normal 3, 4, or 5 out of 5 pain scale. I haven't had probably below a 2 or less in over probably 12 years. So that shows you how long and how hard, how difficult it has been to get here. I should show you a nice little picture of what it looks like when I am injected. It's where it all swells up, and it looks kind of freaky at first, but that goes away. That swelling kind of goes into the other areas, and it, that's a close-up of right after. I've gone to the mall and in public, and people don't really react or notice. It is wonderful to have these, since these nerves are always on and in pain. It is great to have even just a lower level of pain, and this is a great way for me to get off of all of the over-the-counter pain medications. And that's the hope. I've reduced greatly since starting Botox and starting these nerve blocks. I really noticed really quickly that I could make changes, and I really worked on it hard. So some of it is the mindset. A lot of it's the mindset, and knowing that I had to, because my body is, angry about it. All those pills have adverse effects on the rebound headache problem. So your body will create more headaches just so you can get those drugs again. It wreaks havoc with your digestive system and your other parts of your body. No matter what you're doing, pain sucks. If you've ever been frozen at the dentist, you shouldn't have a problem with a lot of these. They use the same stuff, some of the same ingredients, and then sometimes they add steroids and other items to it. So talk to your doctor, your neurologist, your pain clinic people of what they're doing. So even though they're doing the block in one spot, it does diffuse out and spread to the nerves that are nearby it. So they can do it between the two, and it will get both, which is fantastic. So they don't have to hit the nerve right on. And if it gets into your bloodstream, it's not a big deal because it's not enough to cause harm or seizures, or, it won't cause heart problems, breathing problems. It's just enough for that area, and it's a pretty big deal, but it's not enough to be dangerous if they mess up or you move or something happens that way. Now, when they do my forehead and scalp, it is painful. You do notice it, so be prepared for that. It's worth it because you have a few hours of some relief. So some patients find that the anesthetic, the occipital nerve block, takes their headache pain away right away. And it's like gone. So I would love to be one of those people, but I'm not. But it does make a huge difference, so it's still totally worth it. I say do it. I can get them free through my healthcare programs. So if you can get them free, try it. It's totally worth a try. I'm like of the 3% that gets the migraine from the Botox, so me getting the headache the next day from this is pretty understandable, because anything and everything that can give me a headache does. So it says, in some individuals, repeated injections may prolong the duration of the beneficial effect, and I have found this happens. I don't have any, affiliation with any of this. I just am sharing what I have learned and experienced. I am on the more extreme side of the headache situation, but I am hoping that maybe by sharing this with you, you will learn things that may help you speed up your journey to find relief sooner than I did. And so if my journey will help others to find the happier, healthier side of life sooner, then I wish you all the best. Hopefully you can find your best, or we can all get better, and just better, because there's got to be better. So I hope this has helped you with your headache issues, and if you have any questions, please comment below. Look into it carefully. Do what's safe and what's smart and best for you. And good luck, because headaches suck.